area of Niani outside Musina in Limpopo. November to April is considered malaria season in South Africa, but cases occur throughout the year. The World Health Organization says malaria deaths could double in Sub-Saharan Africa as anti-malaria campaigns have been interrupted by the coronavirus pandemic. Earlier, we spoke to our reporter Rudzani Tshivhase. We're going back to him right now. Rudzani, what's the latest? What have you got for us?
Different teams, malaria teams are busy spraying here at Hagumbo, as we earlier indicated. As you can see from on my left here, I'll ask my cameraman Musama Maila to show you the MEC for Health in Limpopo, Dr. Kokera Matuka, and the mayor here, the local mayor of Musina, and the executive mayor of Vembe, and other people are here assisting the spraying teams of malaria, because they are saying this spraying is the only way that they can beat malaria. They are using DDT and other chemicals here. But with me here, I'm with the MEC, who will explain in full what are they doing here and how is the malaria case, how are they treating malaria cases in Limpopo in general. MEC, Dr. Kokera.
Morning, Rudzani, and morning to all your viewers out there. We are here because, as you will remember, that malaria season started in September. But this is one of the area where from January up until July, we recorded 32 malaria cases. And that is a worrying factor for us in this particular cluster. But what is comforting is that with the current new malaria season, which is July to now, we have only recorded one case. But of course, we are comforted by the fact that from January up until today, we have not lost any single case of malaria. Yes, you're quite right. This is the only way that we as government can make intervention to empower the community for them not to be getting infected. If you remember what happened in the financial year 17-18, where we registered more than 18,900 cases of malaria in the province with 160 deaths, we are coming from a long way if you look at it. During the time where the communities were rejecting us when we wanted to do indoor residual spraying. That is why the following year, when we had to take it over and provide leadership from my office, where we start with me to fumigate and do the indoor residual spraying. If you look at it, the following year we reduced malaria cases to 6,000, just over 6,000, and 48 deaths. And if you go down the previous financial year, we had around 3,000 cases, which we reduced them by 50%, and also only 19 malaria death cases. So this year, the whole province, we have only registered from January to today two malaria death cases. And we were saying one malaria death case is too many because malaria can be prevented. This is one of the best methods to prevent malaria, because as you see me spraying here with this chemical, mosquitoes cannot stick on this wall. And this can last for 3 to 4 months. But you know, when we receive rains, that's when we must always continuous, because indoor residual spraying must be a continuous program that we continue to do throughout the province. So the other ways, it's where an individual themselves can do. We are always encouraging communities to say, let kids not be playing outside after sunset. And also you as adults, try to get into the house. Those who can afford to put up a fan in your room or an aircon, if you use that, you will be able to protect yourself. If you wear your pajamas, you must wear the ones that covers long sleeve ones and don't wear a short sleeve one. We can still use mosquito coils and all that. And especially those who will be visiting our province, we're welcoming all the tourists come December. Even this particular area where you've got Wanedi Resort, you've got Chipise, you can still come. The mayor is here, will invite you to join and enjoy your festive season in this area. All you need, please visit your doctors 2 weeks before you come here. They'll give you malaria prophylaxis, and when you're here, you can be protected.
Let me see the link between malaria and the pandemic COVID-19. in terms of symptoms?
Yeah, that's one area which it's really quite interesting, because when people they've got headaches, both of them, some vomits, both of them, some we've seen some patients having diarrhea, both of them, but fever and headaches are common in the cases. So that is why what we have decided as the Limpopo Department of Health is that every case that present with headache in our clinic, don't just screen for COVID, also screen for malaria. If you look at our response teams, the professional nurses and the community healthcare workers that go on a community-based approach towards fighting COVID, we have included, especially in the area of Mopani and Vembe, malaria test kits. We're saying when you get into a household and you screen for malaria symptoms, which are the same as COVID-19 symptoms, when you test, collect specimen for COVID-19, immediately also test for malaria. The good thing with malaria is that we are at advance in terms of its testing and also in terms of the treatment. Immediately, because we have got professional nurse, they also have got a medication, just need an oral tablet to take and you will be cured. The unfortunate thing about malaria is that if it's not detected early, by the time we detect it, it will have complicated to cerebral malaria, and that becomes difficult for us to be able to treat. And we must also appreciate the fact that here in SADC, in Sub-Saharan Africa also, we are having many more people dying of malaria, which might not be making an international headlines. You won't read about it or find it in the other international media, because it's not killing them. It is killing the people in Africa. So that's why you see us as leaders in Africa and in SADC to be able to take responsibility and leadership to make sure we protect our people, because malaria is a problem to us. It might not be a problem to them out there. So that's why you see us to say, while fighting COVID, which is a global pandemic, malaria is still a SADC pandemic. Malaria is still an African pandemic. So, and malaria can be prevented and it can be cured. That's why if we put our efforts, we can save as many lives. The life loss of COVID and the life loss of malaria is still a life that is lost.
There you had it, Desiree, a link between symptoms of malaria and the symptoms of COVID. They are almost the same. So it's up to our people to take care. Each time we feel dizzy, headache, we should quickly make contact with our clinics or doctors. Back to studio.
Rudzani, thank you so much for that update. And from one area of Limpopo